I'm delighted to be here today to present the RTN highlight session for 2025. I'm going to talk to you or take you through the advances, challenges, and innovations in nuclear medicine brought to us by radiographers, technologists, and nurses this year. This year's session reflects a pivotal moment in the evolution of nuclear medicine, where innovation meets practical implementation underpinned by rigorous evidence and multidisciplinary engagement. From operational efficiencies in corporate finance to cutting-edge intraoperative imaging, the field is embracing both technological advances and critical workforce development. The highlighted RTN sessions reflect robust alignment with NHS guidelines, regulatory frameworks, and global best practices. I will take you through emergent themes, clinical breakthroughs, leadership strategies, and forward-looking recommendations, all presented during this year's RTN landmark sessions. So we start with corporate finance in nuclear medicine. The financial dynamics in nuclear medicine require strategic precision to support sustainable service delivery within the NHS structure. Effective cost control, as emphasized by the NHS Improvement 2020, not only ensures operational viability, but also reflects stewardship of public resources. Colleague Nuno Martins from Guy's and St. Thomas will present us with an introduction to several finance tools which can be used on our day-to-day service improvement and or to strengthen our business cases. Finance in nuclear medicine isn't always visible, but understanding return on investment and cost effectiveness is vital for sustaining service growth. These principles must guide all departmental and board-level decisions, and when financial integrity and viability is integrated into clinical foresight, nuclear medicine can thrive even in constrained environments. With increasing diagnostic reliance on PET-CT, fostering a high-performance culture is paramount. NHS England's 2024 PET-CT specifications highlight the demand trajectory and needed strategic workforce planning. Institutions must anticipate capacity challenges and cultivate environments resilient to service fluctuations. Transformational leadership invites a shift from directive to empowering management, and when leaders inspire, align values, and trust their teams, innovation flourishes and retention improves. Culture is leadership in practice. Colleagues Sofia Ferreira and Paul Lockwood will be exploring the workforce culture and leadership within PET-CT departments across the UK, taking us through a survey across UK PET-CT departments. I'm not allowed to say what the outcome is, so I'll leave that for the session. Colleagues from the University Hospital of Coventry will be discussing the introduction of PET-CT into surgical theatres led by clinical technologists. A presentation from this team has already been highlighted here today. This marks a shift in procedural innovation in with the UK first RTN trial for margin assessment. Kirsten Jackson's team successfully trialed intraoperative scanning, revolutionizing the real-time margin assessment process in surgery. Ensuring staff are fully trained in radiation protection principles as per IRR 2017 is a non-negotiable. It ensures not only patient safety, but also occupational compliance, a key determinant for scalable rollout across surgical hubs. Finally, the customized nature of intraoperative equipment demands strict adherence to MHRA medical device regulations. Technologist-led innovation is not merely technical, it's strategic, regulatory, and profoundly collaborative. Pediatric PET-CT is a domain where precision and empathy converge. Vali et al. In 2021 highlighted the importance of pediatric-specific protocols for tracer dosing and acquisition timing, which is critical for reducing radiation burden without compromising image quality. Equally vital is the scan environment. NICE 2021 guidance on patient-centered care is especially pertinent in pediatrics, advocating setups that reduce anxiety, such as parental presence, distraction tools, and visual themes. Finally, pediatric competence isn't just technical, it involves specialized communication, emotional support, and safeguarding practices, all built into HCPC training frameworks. Excellence in pediatric imaging starts with holistic care. With a rise in 141% in pediatric PET-CT requirements, this team's patient-centered approach is a great example of how we can adapt pathways to children's needs. The practice educator's role in nuclear medicine has evolved from support to strategic leadership in clinical competence. As per IPAM 2019, structured CPD frameworks ensure continuous development across evolving modalities and staff grades. The practice educator role supports staff with hands-on training and bridges the gap between education and practice, which is critical for a skills shortage landscape like ours. Aligning with NHS England's workforce planning strategy, practice educators also play a crucial role in future-proofing services. They help retain staff, identify upskilling pathways, and ensure that innovation doesn't outspace capability. This is a presentation brought to us by our colleagues Hannah Chandler and Carolina Rodrigues. And then the hot topic these days, artificial intelligence in nuclear medicine. It has rapidly shifted from a speculative frontier to a functional assessment in nuclear medicine. NHS Digital Strategy outlines a structured path for integrating AI into NHS workflows, aiming to improve both productivity and clinical outcomes. The Royal College of Radiologists Imaging Informatic Guidelines underscore AI's role in automating routine interpretation, enabling focus on complex diagnostics and interdisciplinary collaboration. Standardized, explainable AI models are central to trust building. Educationally, the GMC encourages training environments that foster AI competency. This ensures that current and future nuclear medicine professionals not only adopt these technologies, but critically engage with their outputs for safer, smarter diagnostics. Artificial intelligence in nuclear medicine is a comprehensive review of applications and future directions brought to us by our colleague Clara Ferreira from NHS England and Coventry University. All these presentations I spoke to you about so far will be taking place on today, this afternoon. So you're all welcome to try and attend. The next few presentations will be taking place tomorrow afternoon at 3 p.m. So the next paper is brought to us by colleagues from UCLH, who will be looking at immunotherapy-induced arterial wall inflammation in oncological patients, true or hoax. As immunotherapies become standard in oncology, nuclear medicine must address a nuanced diagnostic challenge, immune-related FTG uptake mimicking disease activity. The EANM SNMMI 2020 guidelines provide a comprehensive framework to guide clinicians in distinguishing therapeutic inflammation from true pathology. Adopting semi-quantitative metrics like SUV patterns reduces the subjectivity of interpretation. For clinicians, this means moving from a purely visual to a data-supported model of PET assessment, and this isn't new to us. For patients, it offers fewer misdiagnoses and more informed clinical decisions, particularly in a complex immuno-oncology context. The study reminds us to carefully interpret PET images in patients on immunotherapy. Some hotspots may not be pathological, but a drug effect. Also from UCLH, Hyperglycemia significantly impacts the diagnostic accuracy of FDG PET imaging, particularly in oncological applications. The SNMMI and EANM 2022 procedure standards emphasize strict pre-scan protocols, including fasting and glucose level thresholds to mitigate variability in tracer uptake. Uncontrolled glucose levels can lead to decreased FDG uptake in neoplastic tissues and elevated uptake in skeletal muscle or myocardium, producing confounding artifacts. The BNMS 2024 addresses this with clear operational recommendations tailored to diabetic and non-diabetic patients alike. For practitioners, adherence to glycemic control protocols translates to more reliable interpretations and fewer repeated scans. It's a foundational yet often underappreciated determinant of FDG PET quality. With the aim of investigating whether hyperglycemia occurring in fasting conditions and diabetes mellitus affect the detectability rate of disease in FDG PET, studies performed in oncology patients, our colleague Rahul Murali is going to take us through a literature review exploring the effect of blood glucose levels on FDG uptake in normal organs and tumors. I'm not going to disclose anymore. From Manchester University NHS Foundation Trust, colleague Barbara Hughes et al. Were interested to know about the utility of unfractionated heparin in the suppression of myocardial FDG uptake in cardiac sarcoid PET scans. Accurate imaging of cardiac sarcoidosis via PET depends on suppressing normal myocardial FDG uptake, which can obscure inflammatory signals. The SNMMI ASNC consensus from 2020 highlights heparin administration pre-scan to increase glucose transporter suppression in healthy myocardial cells. This is reinforced by dietary strategies. The American Heart Association advocates for a 12 to 24-hour high-fat, low-carbohydrate diet, followed by fasting to optimize FDG bioavailability in pathological versus physiological tissues. For clinicians, this approach combines pharmacological and nutritional modulation, minimizing interpretive errors and enhancing scan sensitivity in inflammatory cardiac conditions. However, it will be interesting to see how the use of IV and fractionated heparin influenced cardiac suppression in this study. The study suggests a potential protocol simplification backed by data. And finally, the use of choline, F18 choline and parathyroid imaging presents a powerful tool for localizing hyperfunctioning glands. According to the BNMS and SNMMI 2022 guidelines, precise imaging timing post-injection is critical to maximize lesion to background contrast and distinguish adenomas from physiological uptake. Quantitative PET measures, specifically SUV values, enhance reproducibility and objectivity. Recent research offers a robust methodology for SUV standardization, enhancing inter-site comparability and reporting consistency. Combining these standards ensures that parathyroid PET studies are both clinically informative and methodologically sound, reinforcing the role of quantitative PET in surgical planning. This presentation is from St. Bart's, entitled F18 Fluoromethylcholine parathyroid imaging. Does one-stop shop work? The aim of their work was to determine the best time point for imaging without compromising diagnostic value. So the convergence of themes across the 2025 RTN presentations at the BNMS Spring Meeting reveals recurring priorities: workforce sustainability, quality, and innovation. Workforce strategy, underpinned by the NHS People Plan, remains central to addressing increasing service complexity, ensuring the right skills are available at the right time. Standardization, supports equity, interoperability, and data harmonization, making cross-site audits and quality assurance feasible. Financial considerations are ever present. NICE and NHS improvement guidance advocate for models where service excellence isn't sacrificed by economy. Together, these themes reflect a cohesive vision for nuclear medicine's future, integrated, responsive, and evidence-led. So future directions. To stay ahead in nuclear medicine, research must address not only scientific frontiers, but also organizational capability. The King's Fund and NHS England have set clear imperatives for developing resilience leadership that prioritizes staff engagement, mental health, and role progression, which are cornerstones for staff retention. Equally, innovation cannot exist in a vacuum. The RCR advocates for structured digital integration, systems that not only acquire technology, but make it usable, secure, and impactful across multidisciplinary workflows. Future research should therefore integrate clinical outcomes, workforce insights, and policy frameworks. This alignment ensures that innovation is not just developed but deployed in ways that really matter. So to conclude, the BNMS Spring Meeting, RTN proffered papers reinforce the need for strategic cohesion across all dimensions of nuclear medicine. The NHS long-term plan offers a guiding framework for aligning leadership, patient care, and technological innovation towards unified objectives. Multidisciplinary collaboration emerged as a cornerstone theme, encouraging shared responsibility across technologists, physicians, educators, and policymakers. This promotes continuity, adaptability, and excellence alongside with resilience. As the field advances, success will hinge not on isolated breakthroughs, but on integrated strategies that bridge gaps between finance, regulation, education, and research. The momentum from this meeting sets the stage for a collaborative, future-ready nuclear medicine landscape. On our RTN sessions, you will have holding slides that we would very much like you to use if possible. Please provide us feedback because that feedback will help shape the direction of future BNMS activities and national strategies. Let's collaborate to refine our collective understanding and improve nuclear medicine for all stakeholders. Thank you very much.